I think something got lost in translation.
Alberta making a pair of policy reversals after public backlash. The first flip-flop over a move to allow ministers and senior staffers to expense more than $100 of tax money while no longer having to publicly post their receipts.
This is totally unacceptable. I have no idea who thought this was a good idea, because it's a really bad idea.
The government also deleted 8 years of expense claims from the province's website, the changes sparking criticism at a town hall in Edmonton last week.
Could you please be responsible to taxpayers or explain why?
I can't because I'm confused by that too.
But the Premier insists it was all a misunderstanding.
We've gone back to the original intention of the cabinet direction, which was to maintain the posting of receipts, but to redact the hotel information so that we can put the safety of our caucus and cabinet members first, which was the intention.
The NDP is not buying that explanation.
The UCP government was caught with their hand in the cookie jar, and Albertans expect receipts, expect disclosure, expect to have their taxpayer dollars used in a way that they agree with.
The UCP has also now committed to pay for COVID-19 shots for healthcare workers. The initial plan for this fall left many nurses, doctors, and paramedics paying out of pocket, to the frustration of their unions.
Seems to be the summer of UCP flip-flopping. They are rushing out poorly thought decisions that Albertans don't agree with and then having to roll them back and having to adjust. It's causing a lot of stress for a lot of Alberta families.
The Premier says the shots will be optional for health workers, but Albertans who are not deemed at high risk will still have to pre-order and pay around $100.
Well, we'll try it this way. This year we are trying to mitigate costs because it is an expensive intervention. We don't pay for every vaccine. The shingles vaccine, for instance, we don't pay for.
The Premier says last year more than half of COVID-19 vaccines were unused and $284 million worth of shots were wasted in the past 3 years. She added an update on the cost to buy vaccines for health workers will come on Friday. From Edmonton, Sean Amato, City News.